Hello, and welcome to Eaton's latest Current Thinking broadcast, where industry experts come together to talk about the latest trends facing the electrical industry. My name is Justin Karan, and I'm the Director of Buildings and Campuses here at Eaton. And today we're going to be talking about a topic that's on everyone's mind, and that's the energy transition. Specifically, we're going to discuss the decarbonization of the healthcare industry. We have a fantastic panel of experts that are joining us today, and I'd like for them to each introduce themselves, starting off with Allegra.
Thank you. I'm Allegra Wiesler. I'm a sustainability advisor for Ohio Health. Ohio Health is a healthcare system here in Central Ohio. We have about 15 hospitals, and we're spread over about 50 counties. So my work's really looking at decarbonizing that entire footprint.
Excellent.
I'm Sanjay Rajagopalan. I'm the Chief of Cardiovascular Medicine at University Hospital's Harrington Heart and Vascular Institute, and I'm a Professor of Medicine and Biomedical Engineering at Case Western Reserve School of Medicine. As a cardiologist, I'm really interested in decarbonization. I have a long-standing interest in the intersection of pollution and climate change on health, and in particular cardiovascular health, and it's great to be here with you guys.
Very good.
Hi, I'm Christina Vernon-Sanborn. I'm an associate principal with Mazzetti and a senior decarbonization specialist, and I help my healthcare clients on their decarbonization journeys.
And I'm Kara Brooks. I am the Senior Associate Director of Sustainability for the American Society for Healthcare Engineering of the American Hospital Association. And I lead the strategic direction for sustainability for the association, as well as advocacy and program development.
Well, excellent. And this is such an exciting topic to talk to everyone about, so we really appreciate your time today. And wanted to really dive into it because we have a lot to talk about on this subject. And the first theme of questions that I had for each of you is really going to center around, I guess, what I'm going to call the opportunity to decarbonize. And Allegra, I'm wondering if you could lead us off and really talk about the why. You know, like you mentioned, Ohio Health is really taking a leadership role. Why are you doing that? You know, why is there such a big opportunity for healthcare systems like yours to decarbonize?
Yeah, no, that's a really good question, because if you think about the healthcare industry as a whole in the United States, you know, it makes up to 10% of the greenhouse gas emissions in the United States, which, you know, makes sense, right? We're a very energy intensive industry. We produce a lot of waste. So with that, it's just inherent to the work that we do on a day-to-day basis as a healthcare industry. But Ohio Health has realized and recognized that there's a connection between environmental issues and human health issues. So what we've done is really try to connect the decarbonization sustainability work that I do for the organization to the mission to improve the health of those we serve. So it's really become a mission-driven initiative for the organization. But we're also seeing it as something that newer generations of associates and physicians and clinicians that are coming into our industry are just starting to have an expectation that we have sustainability and decarbonization work, and that we understand as an organization that we're doing the best thing we can for our patients, not just within the hospital walls, but outside of the hospital walls as well. So it's really also helpful as a retention tool and a hiring tool for organizations as well. So for us at Ohio Health, it's been extremely deep connection to the mission. It's very human health centered. And it's something that all of our clinicians and associates have really been passionate about since the start.
Great, and Dr. Rajagopalan, we're super excited that you joined us today because we rarely have access to the clinical side, and I think this discussion is really going to hit home for you, it sounds like. And I was wondering if you could kind of elaborate more on what Allegra just said around the human health opportunity, the linkage between population health and decarbonization.
No, great question, and I sort of echo what Allegra mentioned. I think healthcare in general, at least in North America, is a major contributor to greenhouse gas emissions. And there's a great opportunity to transform health once you start to make the connection between decarbonization and sustainability. And what I mean by that is the effort, the connections between decarbonization and the impact that it's going to have on pollution and the footprint that the healthcare industry currently has, which is often underappreciated. And once you start to link decarbonization as just not representing reductions in greenhouse gases, but also a reduction in environmental pollutants and the footprint that healthcare organizations have, you start to uncover this major driver of what Allegra mentioned, is a responsibility that organizations have to the welfare of the communities that they serve. And once you make that connection, it starts to get very different. Then it becomes a very mission-oriented, purpose-driven exercise to try and hold healthcare organizations responsible for what they profess to be, which is to take care of the welfare of the citizens and communities that they serve. So I think it's a transformative opportunity. Decarbonization is a transformative opportunity for hospitals to start to link their mission with a deeper purpose of preserving health for the communities that they serve.
That's fantastic. And Kara, I've known you for several years. You're always out in front on the circuit. You do a lot of guest speaking. You have a lot of really good relationships, not only with in the healthcare industry, but also in other industries as well. So I'm curious to get your opinion on where you think the healthcare industry compares to other industries as far as their path to decarbonization. Is the healthcare industry ahead of the curve? Is it behind? What do you think there?
Yeah, so the healthcare industry is, they tend to be a little bit behind the other commercial building industries. Universities, as an example, tend to be a lot further ahead than us. But as Allegra and Sanjay both said, we are responsible for a huge amount of the emissions. And if you look at that in the US, where the healthcare industry is responsible for 8.5, 10%, something like that. And if you look at it globally, we're responsible for about 4.4% of the global emissions. So if you think of that like a country and you compare, it's interesting that globally healthcare is responsible for we're about fifth in line for, if we were a country.
That's substantial.
And it is, and that's behind the US and China and the Russian Federation and India. So we have a huge impact. There's a lot of work going on at the local, the state, and the federal levels. State and local jurisdictions are passing carbon targets, they're passing energy targets. It's kind of an array of a lot of different things. But as you know, the Biden administration has had a keen interest in this work. And in 2022, I think it was, the HHS created the Office of Climate Change and Health Equity. And with that, they also created the Climate Pledge, and that's specifically for healthcare. And that is to reduce the carbon emissions by 50% by 2030. So those goals are pretty substantial.
Yeah, it's aggressive.
And over 100 hospitals and health organizations have signed that pledge, which is great. There's also been interest with the regulatory agencies, like the Joint Commission, and they started to look at this again in late 21, early 22, and just had a real interest in helping with the carbon footprint for healthcare. At that time, they developed a technical advisory panel and got people together to really look at their standards and tell them what are the barriers, what are the opportunities. And when they did that, they came up with some ideas for making some changes to the standards. The Joint Commission did put out a survey and asked the field, what do you think? And they got pushback, but it happens. So what they decided to do is make this much more of a voluntary effort. And they developed a certification program. So in January 24, hospitals can be certified and can be recognized for their great efforts. So I think, again, has been said, this is a very mission-driven initiative. It matches the mission of hospitals, And it also really helps with the resiliency. So
Yeah, it sounds like there's a huge opportunity for growth, and it's exciting for me to hear that the Joint Commission and other entities are really getting behind this, and there's some momentum building for it. So I wanted to move on to you, Christina, and I recognize Mazzetti as really being on the cutting edge, one of the design firms that's really taken a leadership position in this whole movement, so thank you for supporting that. And so I think you have a lot of clients that might be a little bit more sophisticated, they might be a little bit farther down the path to decarbonization, so there's probably a lot of opportunity for them to even expand what they're doing. And with opportunity sometimes comes bigger challenges, right? So I'm wondering if you could talk about some of those hurdles that some of your more sophisticated clients have faced with the decarbonization opportunity.
Well, with the momentum that's taking place in the marketplace, our clients really run the gambit from those that are just getting started out to those that are more sophisticated and advanced. And I think what's really ties all of those organizations together is that they have successfully negotiated an emphasis on sustainability and decarbonization with their leadership, even to the board level. And getting that kind of leadership support is really what it takes to move the needle and bring things for the forefront so that they can be executed upon. What we're really talking about here is getting off of natural gas. That's really the big challenge. I mean,
and that's hard.
That's hard. It's integral to delivering patient care. We use steam in important processes within the organization. And right now, generating steam via natural gas is the most efficient way to do so. But we need that steam. We need to be able to sterilize our devices. We need to be able to humidify our ORs. Patients come first in everything that we do. So we have to start looking at new technologies that can help us produce the steam that we need and produce the heat that we need in order to be able to deliver patient care on a reliable and affordable basis. And that's really where our work comes in. We're working with clients who are trying to explore how they can go about this in a meaningful way. And one tip that I have and one opportunity, I think, is to think about your deferred maintenance or your facilities condition assessment path. Most organizations have done a facilities condition assessment, and what that does is identify, oh, I've got 10 chillers and they've got this much service life left in them. And that's your plan right there, because every opportunity to replace a chiller at the end of its service life is an opportunity to switch to a heat recovery chiller or to move to a heat pump from a boiler, or to move from a natural gas boiler to an electric boiler. And over time, you can start to really make progress on those big building systems. Those are the big muscle moves that it takes to really start to move away from fossil fuels and deliver care in a carbon-free atmosphere.
Great, and that's just great advice for our audience. And so does anyone else want to add anything to what Christina said, or we want to move on to the next?
I could add something.
Sure.
Just thinking about those projects that Christina was talking about, how do they fund them? How are healthcare organizations going to go about that?
That's a good question.
And there's funding out there that's available through
what's available,
the Inflation Reduction Act has funding available, and so hospitals can get funding for those energy-specific projects. They can get funding for their electric vehicle initiatives and for their renewable initiatives. So it's a great example. So a lot of people hear projects like that and they think, how are we going to do this? But there is funding available now.
Yeah, just out of curiosity, has Ohio Health looked into the IRA at all, or?
Yeah, we're just getting started, kind of like everyone else is in this space, but we've pulled together a team with our internal tax team, we have our accountants, the sustainability team, and we brought in design and construction and our fleet team into the conversation to understand how do we best utilize the available resources to us right now. And honestly, it's been a game changer for the ROI. And when we talk about funding energy efficiency projects, they're usually capital projects. And what we're starting to look at is not just what's available out there, but also how do we start to look at not just the first cost, but the operating cost of this equipment. That's been something that's been a different thinking than I think what we're used to. And we're not, I'll be honest, we're not quite there yet. But it's something that's been, coming up in conversation is just how do we look at more efficient HVAC when we replace existing HVAC to make it, operating cost is going to be reduced. And even though it might be a little bit more expensive up front, we have the IRA to help offset that upfront cost. And we now have lowered operating cost. So that's been something that we've started to look into. And it's been, like I said, pretty game changer.
Yeah, sounds excellent. So I wanted to slightly shift gears a little bit and kind of talk about what I'll call the journey to decarbonization. And I think it's safe to say that the journey can be difficult. It's not an easy one. There's a lot of moving parts to it. Every healthcare system and hospital is in a completely different position, right? Is that safe to say? And so I was wondering if you could give our audience, our viewers, some pointers as to, okay, Ohio Health, you've started this journey, you're committed to it. Where can our audience that is kind of on outside looking in, they haven't done much yet, where can they start this journey?
Yeah, it's definitely not an easy journey, and we're not at the end yet. But I think when we started out several years ago, we looked at, all of our emissions. So you have at a healthcare system direct and indirect emissions.
Okay.
And just for this purpose, we'll kind of tackle the direct emissions. It's really something that, it's the energy and emissions produced on site.
Okay, sorry to interrupt you, but that's what, the scope 1
Yeah,
and 2?
scope 1 and 2.
Okay.
So we're looking at your natural gas, your electric, your fleet vehicles, anesthetic gas, and refrigerants. So for us, when we got started, and you're looking at, like Christina mentioned, you got to remove your natural gas, but you got to start at energy efficiency, right? Load reduction has got to be number one. Energy efficiency has to be number one. We started with, things like LED retrofits. That tends to get leadership support from an ROI perspective. It directly impacted our energy use intensity scores. So that was and it's a very visible project, right? Our facilities teams are usually working behind the scenes. Mm-hmm. No one thinks about how the chillers are operating, but you can see the lights.
It's out
right?
in front of you, yeah.
And it's also we've had great feedback from our nursing staff. It's, it's lighter and brighter. The hallways are more, safely lit. So overall, it's been a really good, easy, kind of foot in the door project for us. But we're looking at everything, you've got to look at your chiller optimizations, your, steam traps. You've got to look at your setbacks for HVAC and lighting. And once you start to get your energy efficiency kind of handled, then you move to that electrification phase. So how do you reduce natural gas? Is it looking at your kitchens? Is it looking at different equipment? How do you build for the future?
And we've had conversations where you've mentioned the electrification of fleets and
exactly.
electric vehicle charging.
Yeah, no, that's
is that a good starting point as well?
Yeah, it's your buildings and your fleet, right? It's, moving away from fossil fuels, which has that human health impact. When you look at electric vehicles, you have zero tailpipe emissions. You can use IRA money to help offset some of the upfront costs. And we see operating costs that are saved from not having to, do oil changes. And it's just, for us, it's been...
Is it a win-win-win? That's what it sounds like.
And everyone loves driving electric cars. But it's just something that when we got started, that's kind of where we started targeting, is that electrification phase. And then you start building for the future. So I think there's, place to get started is, for us, very first step was energy reporting. We did a lot of energy reporting. Our system, we're heavy consumers, like I mentioned, and just reporting out the historical consumption over time, reporting all of the wins that our facilities teams have made in the impacts of LEDs and the, optimization projects and setbacks, just to illustrate that on a report card that goes out to leadership.
Sure, I was just going to mention that. It must be having those dashboards that can simply articulate to leadership as to the progress that or even if you're not making progress, you can see the areas
right.
that you need to improve upon.
Yeah, it's where your money goes, right? It just shows the pathway and history and helps target for the future where different projects need to be invested in. And then that's where you start to communicate that difference in why we do energy projects into the human health piece. And I think that is the big key for healthcare systems.
Yeah, I think that's a great segue to my next question to you, Dr. Rajagopalan, is I think sometimes in order to start this journey, there needs to be a voice outside of the traditional facilities and engineering departments. And I think there's a much larger role for physicians like yourself to play. And can you give us like your thoughts on how physicians like yourself can actually, I don't want to say promote, but I guess endorse and be that advocate for sustainability within the hospital?
No, these are great questions, and I'd like to add and echo what Kara mentioned and Christine mentioned, which is there are some, let's be honest, there are some real obstacles for hospitals to start to transform. You know, this is not something that's easy for many hospitals. We are in a very, very difficult financial environment for most hospitals, and it's a very reactionary environment where people are looking constantly at their budgets and financials, and healthcare margins are very, very small. So this makes long-range thinking investments difficult for most people, and it's not the first considerations. Most hospitals are not. I mean, they're thinking about sustainability, but not in the real sense. Okay, let's be honest. The way to do that, and I think, Kara, you alluded to this a little bit, is first is to, I sort of view this as three important lenses. One is the political buy-in, number one, which you need to secure. This needs to come in from leadership at a very high level. Otherwise, it's not going to happen.
Okay.
Secondly, strategically, you need to have a real good game plan. Thirdly, culturally, you need to be able to communicate this to the hospital, to people.
And why you were doing
walk
this?
By, and everything in your hospital needs to talk about the links between health and why you're doing this. Most people don't think it's an imperative to decarbonize. Let's be honest. You know, I think it's great. I think it's important. But the average man in the street, the average patient is not thinking about decarbonization. Not, you know, unless you make this, you have regulatory levers to do it, to change behavior. You have financial incentives to do it, all right, which aren't present right now. So as you were talking about, how do you really, and very great comments about how do you start thinking about changing your engineering investments over time, are all things that you need to do, take an inventory report. But let's be honest, I think you need the strategic and the political buy-in, number one, to do it. But I think the way to get started, and you mentioned this, Allegra, is to really make it very visible to the leadership as to how it can be done. And that's by dashboards, by communicating short-term savings. Very important. Short-term savings are important. People are not interested in 10 years, 5 years down the road right now. The average CEO is not, I mean, you know, the average, let's be honest, the average half-life of a CEO is 3 to 4 years, okay? He answers to a board. He needs to get the job done. He needs to pay the bills, right? So decarbonization is, unfortunately, and I hate saying
No,
this.
this is a frank discussion.
It's really, really hard for people to stomach the fact that they have, you know, traveling nurses that they need to pay every month, okay, because their ICUs are not being staffed. Give me a break, right? So these are very, very important, issues. So if you don't have the political will to solve it at the very highest level, and that's where it starts. And the conversation I like to take is often to make the link between health outcomes and the community impact. People talk about community impact. Well, this is a great way to impact your communities, to talk about the environment, to talk about the anthropogenic fossil fuel footprint and the effect that it has on the communities that you serve, and make the business case for it. And there are short-term savings that you can demonstrate. You can do that. And small wins, right? And then it becomes an avalanche. But you start small, and you have to start somewhere.
Yeah, so after you pass the low-hanging fruit phase, Christina, and you get to the more challenging decarbonization projects along this journey that we're talking about, such as, I mean, you could say like the electrification of a centralized energy plant, or I'm sure there's several examples. I mean, what can you tell our audience about some of your clients, some of the lessons learned, and they've embarked on some of these more intensive, more challenging projects?
Yeah, the low-hanging fruit is out there and needs to be tackled. So I don't want to minimize the importance of starting with something and not standing still. So while we measure, we should also be taking action, and getting our handle on our energy performance needs to happen while we're planning to actually change that energy performance. So we need to be active in this space. There's very little time for us to get this right. We have a goal out there through the HHS pledge to get to 50% by 2030, which is right around the corner. And that's 100% by 2050, which is also right around the corner from a big picture perspective. So once you get past that low-hanging fruit, which I would argue even the most sophisticated organizations still have low-hanging fruit, once you get past that, then you're really looking at some of the more advanced practices. We have a client in California that is installing a microgrid with battery storage, solar,
That's
and
fantastic.
fuel cells to really allow the campus to be able to island. That microgrid will supply 80% of their annual power needs, which is really significant. And they're actually taking advantage of the IRA as part of the ROI of that project. They actually just received a Department of Energy grant to make that project even more financially feasible. So taking advantage of all of those incentives out there and really looking holistically at your energy profile, your building systems, and thinking about ways that you can make bigger muscle moves is where the more sophisticated clients are at. You know, making those incremental gains has to happen too. But having the plan for how you're going to get to zero is a much bigger challenge, and requires really creative thinking to make it work. Now, the client that I mentioned, that math all pencils out to be to their advantage, to their advantage. It allows them, they're in California, utilities are very expensive there. They were looking at end of life of their substation that they were serving, and they were going to have to invest an enormous amount of capital in that substation. And they were looking at a whole host of decaying assets, assets that were coming to the end of their useful life through their facilities condition assessment, and looking at all of those capital investments hanging out there. And instead of just doing like for like or doing like they always did, they took a step back and they said, how can we address this problem holistically? And how can we do it for the right reasons? And it's wonderful to see the transition of the culture of the institution as they've really worked hard on promoting and explaining why they're doing this microgrid and what it's going to do for the hospital in terms of reliability of care, reliability of their utilities so they can deliver care. They've also really changed the dynamic of conversation to be focused on that human health puzzle, part of the puzzle, to say we're not just doing this because it's the right thing to do for our business, because it is. We're not just doing it because it's the right thing to do for the environment, because it is. We're doing it because it's the right thing for our patients. And that's who we care most about. And that kind of transformation helps them build a collective culture that is going to allow them to do even more in the future. And we're really excited to see as this project comes to fruition.
Oh, it sounds unbelievable. Yeah. And if you don't all mind, I'd like to really chime in from an Eaton perspective. I mean, we're seeing the momentum really starting to build, and we're seeing it happen across many different healthcare systems or even one-off hospitals. And we actually have like similar clients that you just mentioned where they're just ripping the Band-Aid off saying, hey, you know what, we're going to invest a lot of money. We're going to do a transformational project for our campus that's really going to set us up for success when we look at our 2030 or 2050 reduction of emission goals. We also have clients, which I think is more of the norm, that are doing it opportunistic, project by project. They're seeing opportunities, they're taking advantage of it. And honestly, on the opposite end of the spectrum, we have a lot of folks that are not doing anything right now. They're waiting to see how this is going to play out. Some of it is because they don't have leadership buy-in, they don't have the funding, or they don't have the people. We haven't talked a lot about the people behind a lot of this yet. And so I think what's exciting for me and what's exciting for Eaton is that no matter where you are on this journey, on this spectrum of journey, the core technology to make a lot of this happen from an electrification perspective, it's ready for prime time. I mean, you mentioned the microgrid. We have several clients in healthcare that are adopting microgrids as well, which is super exciting. Electric vehicle charging. We're seeing a lot of interest in battery energy storage. But I think where we see the most success, like with our clients that are headed down this journey, and you alluded to it, I know our discussions in the past, Christina, you've talked about it, are the ones that can benchmark, right? They can look at their emissions They can see where they're going. They're looking at their energy use, right? They can see where they need help in certain buildings, certain spaces. They have dashboards in place that can provide some analytics. They can provide some key insights to give leadership some direction as to, okay, where are we going to invest future dollars? Where are we going to get the most ROI? So this all goes back to the digitalization piece, and those are our most successful clients that have that digitalization strategy built into their overarching reduction of carbon strategy. So it's pretty exciting to see, and they're successful. And speaking of successes, Kara, again, you see a lot of the healthcare institutions around the country. You're constantly in conversations with them. Where are you seeing some successes that you could share with our audience? And then the second, so that's only the first question. The second question is, what tools are available? If you could let our audience know what tools are available, whether you're just starting out on this journey or whether you're farther along.
Yeah, so the health systems around the country, they're kind of all over the place. You've got some that are not even thinking about this, and then you've got others who have goals like carbon negative by 2030.
That's aggressive.
So it's aggressive.
Is it possible?
It is possible, and they're working really hard to do that. I think some of the success stories we've been talking about, those who are most successful this is a completely holistic initiative. So this involves anybody and everybody within the institution. It's a top-down, bottom-up approach. So the boards are involved, the C-suite is involved, all of the executives, all the way down to whoever is working in the hospital itself. So one great example of that, I think of a health system that decided to start looking at their anesthetic gases, and specifically their nitrous oxide. And they had done some calculations, and they realized, wow, it looks like we're leaking a lot of nitrous oxide. And nitrous oxide is one of the greenhouse gases.
Okay.
So it has a huge impact on our environment. So when they started to look at that, they kind of took a step back and they said, what can we do? They pulled in facilities and said, we think we have a problem. And so the facilities person was like, I don't think we do. And then they started looking at it and they realized we have a very big problem. And they were leaking over 90% of their nitrous oxide, which is obviously significant. And so just making some behavior changes and system changes that they decommissioned their piped nitrous and started going to canisters.
Okay.
And reduced that impact. It was so great in one of the hospitals that their nitrous leakage impact was greater than their energy. And that's profound.
I didn't even know if that was possible.
But it's just that the impact from nitrous is so much greater. So just doing simple things like that have proven extremely successful. In terms of your second question,
the tools
which was tools that are available. So we've really been working hard on this for a long time and developing programs and tools and resources that will really help our members. Really starts with, like we said, dashboarding, benchmarking, and we have a free dashboard for that called Energy to Care. And any healthcare organization can participate and put in their data. The great thing about that is, as I said, I do a lot of advocacy as well. And as we start to look at energy targets around the country and making sure those are within reason, we actually published the aggregate data and said, what is our hospitals actually operating at? And so we have an energy benchmarking report that just came out. So that kind of helps with that advocacy. We also have we have a number of other programs, like for the top-down approach. We are in the process of finalizing an executive toolkit, and this will allow the executives, it just gives them talking points, it gives them things that they're interested in. And so even if you're a lab technician or a facility manager or whomever, if you need to give those talking points to get the buy-in, you have a tool that you can say, here, this is what you might be interested in. We also have a program, we've talked about the people and how do we get the people engaged.
Yeah, that's an important part of it.
Yeah, so we developed a program called Heal Quest, where it's a team building, culture change, organizational change type program where they do an online e-learning and really learn the basics of decarbonization and sustainability. And then we come on site and do a team building. And within that team building, we actually take them around a hospital and look for opportunities. And at the end, they get to calculate. And what that does is they start to realize that they have an impact. And our goal is that as people start to realize their own impact, that they translate that to their teams. And so, we've designed it so that you can have a CFO, a lab technician, a facilities person, a nurse manager, all on the same team. So they work together to try to find those opportunities. So those are just a few examples. We have all of our tools are on the sustainability roadmap. So we've really tried to design that so the users can take a look at it. They can look at their emission sources as they're related to the hospital and which department is responsible for what and how to take a deeper dive into those.
Yeah, just some great points. And any other thoughts from the panel on I guess we talked about people. Are you seeing that at Ohio Health or with your clients or at university hospitals? It's a challenge. How do you overcome this? Is it just time and training? And there's a shortage of people. You're talking about a microgrid being installed. That's something that someone has to look after and operate.
We have to keep that in mind. As in all parts of the energy transition, we need to make sure it's a just transition. So we need to bring along with us the technicians who are taking care of these buildings. That does require training. It requires investment in those individuals. And there is a shortage of those individuals out there. So we need to make sure that we not only retain, but we upskill those technicians so that they're ready for this new age in how we handle heating and cooling and operating our buildings. They're really the heart of this, and they need to feel like they're the heart of this, and we need to make sure that we're keeping them in mind as we plan the transition for a campus. It's really important.
Mm-hmm.
Absolutely.
I'd like to add to Christine's point. I think the culture change, I think, is a major issue. Mm-hmm. And I really think, we're starting to see this, where there's a larger realization that there needs to be a shift from a disease-based management approach to a health management approach. And that's really important because the incentives currently in healthcare don't exist for preserving health and prevention. And this is really where the issue is. Hospitals and physicians are incentivized to treat disease, but not to prevent disease. And that's a fundamental cultural transformation node that needs to really change. But I'm pleased to say that there's starting to be an awareness that this is starting to happen, and hopefully there will be incentives along to keep costs down, to not relentlessly do procedures, but to think about health and to think about community impact. So that's really, really important. So the financial incentives have to align, and again, as was mentioned before, I think if health organizations start to realize that there is actually a small margin that they can make and at the same time make an impact, everybody gets behind it because ultimately we live in America and there's incentives that could be used in a very positive way to make an impact on health and society. So, and taking advantage of it is, great news to hospitals.
So what happens at Ohio Health, Allegra? You're adopting electric vehicle charging. You're electrifying your fleet. Do you manage that, or does the facility team do it, or do all of you work together on that?
Yeah, it's been pretty integrated, and I think that's where we find it to be most successful.
Okay.
And that definitely takes some education and change management work. Electric vehicles, we did training. That training gets handed off to the fleet team. Our fleet team now manages all of our electric vehicles and charging stations. We have someone that does sustainable procurement work for us. So we have someone that is sitting there, trying to write the contracts and agreements so we don't have waste in the first place, or we have healthier food, don't have styrofoam, and we don't build with unhealthy building materials. So it becomes more integrated into the culture. And what we've done is start to gauge how successful that shift has been in our culture by integrating questions into our annual surveys out to our associates that allows us to benchmark historically internally. But those questions are also asked externally to other organizations that are using the same platform for the assessments. So we could actually see how we're doing in comparison to others from a culture shift perspective. And what we actually have been finding is that many of our associates, irregardless of their generation, actually believe that this work is critical to our mission, and they believe in the work. And even if you just ask, give the people doing the work on the ground the chance to engage in this, they're the experts.
Goes a long way.
It goes a long way. And you ask the nurses in the operating room or the physicians, what are you seeing? How can we make this better? They will take it and run with it and just provide the support and knowledge to help them facilitate the work. We've had nurses that have identified sterilization wrap, which is kind of this wrap that goes around our tools that are used in the operating room. We found out that just at Ohio Health, we produce enough sterilization wrap to cover the state of Ohio on an annual basis. And that's just one healthcare system. So what we did is the nursing staff said, this is a problem. I want to find a solution to it. And we helped them identify a recycling program, and they help collect the wrap, and we take it to a recycler, and they turn it back into reusable bags that our marketing team can use. We're looking at patient belonging bags. But this all stemmed from just asking the experts in the space, what can we do? And then just supporting them along the journey. I think that for us are some of the most exciting projects to see come to life.
Oh, it sounds amazing. And, unfortunately, we're getting short on time. I know everyone on the panel feels so passionate. We probably need to have a part 2 at some point. But I'd like to give each of you an opportunity to do some final thoughts to our audience. And I've asked Allegra, you've started us off so many times that actually, Kara, I'm going to ask you to start us off on this last segment, if you don't mind. Do you have any final thoughts that you can share with our viewers?
Yeah, I think, looking at the why, we started with the why and, how it's important. And one of the ways that we look at it is, Sanjay talked about pollution, and we know that there is a big problem. We know that the effects of pollution, as an example, are increasing our health outcomes and in a negative way. We also know that, as we've said, this is a collaborative approach. We all need to be working on this together. It's not one hospital's problem. It is not a sustainability, person's problem. This is everybody's problem.
We didn't even dive into the shared learning and sharing of, like I said, part 2.
We need to all work together, and that's really important. And we also talked about today just starting small. Start with those small things, and you can make that impact. And ultimately, healthcare is really responsible, and not only is it responsible, we also have a huge opportunity. We know we add to the U.S. and the global emissions significantly. We have a huge opportunity to make an impact and to impact the health of our patients and communities in a positive way.
Christina, any final thoughts to our viewers?
Yeah, first of all, thank you for convening this conversation. I think this is the kind of conversation that needs to happen. We need to bring together people from all different parts of the healthcare ecosystem to have important dialogue about decarbonization and the role that it needs to play in the future of healthcare. For the sake of our patients, our communities, and the sake of our healthcare systems, we need to be successful for the long haul, and this is what it's going to take. I think the conversation is happening in the United States, which is really encouraging to see. We're starting to see momentum in the health sector.
Absolutely.
Which is really important. But we have a special responsibility. While 4.7% of global emissions are healthcare, we're 25% of that in the United States, but we're only 5% of the population of the world. So here in the US, we have a special responsibility in healthcare to tackle our greenhouse gas emissions. We have a real addiction to fossil fuels, and we need to break that addiction and think differently about how we heat and cool our buildings, how we operate our facilities, how we take care of our patients, because really this is what this is all about. It all comes down to being able to deliver care at the highest level of quality with the lowest carbon impact that we possibly can. That's what we're here to do, and that's what we're all about as a healthcare industry.
That was very well said. Dr. Rajagopalan, any final
Well,
thoughts?
I want to make 3 comments. One is thank you for this opportunity to talk about this very important issue. I hope we have many other future occasions to do the same. Secondly, I think the wisdom that's emanating from the women around the room sitting next to me is just profound, right? I mean, so you heard some really, really incredible comments from my colleagues here, and many of them very, very much wise comments that have taken into account years of their own experience working in this industry and really distilling that wisdom to our listeners today. Thirdly, I'd like to sort of end with the idea that physicians have a moral imperative to be engaged in this, and it's a very, very solemn affirmation of our commitment towards health of our patients, and this is a massive opportunity with huge implications because physicians are thought leaders. And if they get into the game of decarbonization and health impact, it's a game changer. So I would really like to see this happen where physicians, it sort of is almost infectious, where it catches on and it becomes a feverish movement to try and transform healthcare systems. And by doing so, you're sending a very strong message to the rest of industry, to the rest of the world. So thank you again.
Oh, our pleasure. I agree completely. And Allegra, last but not least, for once you're you're not going first.
No, I mean, I absolutely echo everything that's been said, right? It's been a clear theme of the why healthcare needs to engage in this work and the science that backs the knowledge and understanding of the connection with environmental issues and human health issues. Ohio Health did sign the HHS Climate Pledge. So we are on track, to target net zero by 2050. Those were goals signed by our senior leadership.
Super exciting.
It's integrated into our board. So we do have leadership buy-in, but that passion is coming from the ground up. And we talk about culture shifting. We talk about needing to engage physicians and our clinicians. I think that's extremely important. But I think we have that responsibility for external care outside of the hospital walls. And I think every single, LED project, every, tweak to the setbacks, that all has a direct human health impact. And I think that, really integrates every single person at the hospital systems into the mission. And I think that itself is kind of the whole journey of understanding how to make the decarbonization pathway work. And I'm really just excited to be part of it.
Very well said, and the passion is overwhelming. I'd like to thank all my panelists again. It was a fantastic discussion, a tremendous amount of passion. So we're definitely going to have future discussions. We'll take you up on that offer for sure. And I'd like to thank all of our viewers that tuned in. If you're interested to learn more about how Eaton is decarbonizing the healthcare sector, please go to eaton.com/healthcare and be sure to tune in again for future Current Thinking broadcasts.